Hey, good morning, everybody. Welcome to another episode of Digital Health Today with a distinctly Australian flavour. I'm Bernie O'Brien. So, just waiting for a few people, ask some questions. We're getting a lot of amazing feedback from our Instagram, our YouTube, and our Facebook. So, please, if you haven't registered or liked us in that area, join and follow us. That'd be great. So today's topic is chiropractic and back pain, specifically lower back pain. So how does it happen? What are the symptoms? What can you do about it? It's a really debilitating, common problem. You know, at least 80-90% of people at some point are going to have really severe low back pain. And that stinks. It really sucks. No one likes that. So let's talk about, well, how does back pain occur? Really simple. You get damage to the body over time. You know, it could be one major episode. A lot of people think that it's one episode because I see this all the time in practice. I bent over to get some groceries. I lifted a bag and then just moved the wrong way and it caught. I woke up and I couldn't move. So when you think about those, very trivial traumatic events, bending over, picking up a bag of groceries, there's no trauma there yet. The sad part is I see it acting like it's extraordinary trauma where people are bent over, they're in agony. I've seen a patient crawl on their hands and knees down the hall to my practice because of this. So really, if we look at that, does that make sense? No, of course it doesn't. It's absolutely nonsense. But most people don't know that. And so why does that one episode create such severe, debilitating pain? Well, the answer lies in this. It's more underlying, like the iceberg in the ocean. Most of it's hidden. And that's what we call a subluxation. Well, what is a subluxation? It's a misalignment of the bones of your spine. When they get out of alignment from trauma, micro trauma, accidents, falls, slips, all that type of stuff, it causes slowly underlying insidious damage. You don't even feel it until you've lost about 40% cell tissue and organ function, meaning tightness, contraction, scar tissue, adhesions. Then all of a sudden, then you wake up that one day, then you pick up the grocery bag, then you bend over, then you cough, sneeze, or whatever, and you can't move. You're in agony. And so you've got this terrible pain, the muscles and the ligaments from pressure on that spine and those nerves really affecting your quality of life. So that's kind of how you get it. So what can we do about it? Well, first and foremost, we need to really view things slightly differently. Most people come to me when they have back pain. Well, that's okay, I get that, but that's a mindset shift that I want you to change here. Because if you understand that the pain is usually, and the symptoms are usually the last phase. A couple of examples, can you have a heart issue or clogged artery in your heart and not know? Absolutely. Can you have cancer in your body and not know? Absolutely, because unfortunately there's no early detection, there's no early symptoms. It's as disease progresses, then you get the symptom. Back pain, subluxation, no different. That's why you get that one episode severe pain when you lift a bag or wake up or whatever, and it doesn't make sense to you. So I would encourage you to get your spine checked. The only way we can see inside of you is with an x-ray. If you've got a chiropractor right now and you don't have an x-ray and they're adjusting your spine, the question I'm going to ask is, which vertebrae? Which direction is it misaligned? And what's their intention with trying to align it? See, if you don't have an x-ray, you can't adjust specifically and exclusively and set that bone where it needs to be to remove that pressure, restore that health, enabling that body to heal from the inside. It's pretty cool. So I'll leave you with a couple of little things here just so you can get a couple of pictures. Just bear with me for one moment here. And a couple of x-rays. So let me flip this around here just briefly. There we go. So right here we have a curvature of the spine. Medically, that's called scoliosis. And you can see from the front to back that it is a 12 degree and an 8 degree scoliosis, all in that low lumbar and mid-thoracic spine. Now the big important thing is that spine should be straight. If we look to the right, this is the same spine after corrective care. It is quite substantially different there between the two. So this is a person that has issues in the spine that created problems in the spine. Now, one other thing I want to draw your attention to, that bone right there, okay, that's a real big one in low back pain. And that's the neck, that's the skull, jaw, neck, first and second bone. And people always ask me, why is that important? Well, because then that one gets off. Okay, it's got pressure on the brainstem, and that's going to move the whole body around this area to keep those eyes level. And so this is the same spine that has a corrected spinal curve, and you can see that. So you have to understand systems, righting and balance reflexes, and how a subluxation and alignment issues can crush those nerves, affecting your body, affecting other areas of your spine that you didn't even know. I guarantee you, most people have got no full understanding of the principle of chiropractic, and you're missing out. So I'm going to leave you with this offer. If you haven't had your spine checked with an x-ray, do it. Do it now. Don't delay. Don't do it because you're hurt. Do it because you want to be healthy to prevent disease. And if you're hurt, don't worry. We still will take you because we want to find out how to correct it, get you stabilized, get you out of pain, get you feeling the best you have in 20 years. So thanks so much. Make sure you personal message me on Messenger or through Facebook or on our Instagram, and you can ask for the voucher sent directly to you. Share this on your posts.